It has been announced this week that the Health Select Committee will hold an inquiry on euthanasia, this following the Lecretia Seales right to die case. But a just-released survey released this morning confirms that doctors are already making end-of-life medical decisions for their patients, with 16% withholding treatment to speed up death, and nearly 5% of doctors reporting prescribing, supplying or administering a drug with the explicit purpose of hastening the end of life. Royal New Zealand College of General Practitioners President Dr Tim Malloy joins me now. Tim, thanks for joining us this morning. It's interesting, isn't it? Because we must have, and we did always know that this was going on, because it is an important part of being a doctor, of caring for people. But this is the first time I have ever seen this written down statistically in a document. Is it the first time you've seen these numbers?
Yes, it is. Having said that, the figures are not a surprise. This would be consistent with my understanding of the activity that goes on within general practice.
So what happened here to compile this report is that a large number of doctors were spoken to about the last time they attended the death of a patient and how they handled that. And as I say, the most interesting one was 4.5% of those doctors reported prescribing, supplying or administering a drug to hasten the end of life. That is euthanasia, isn't it?
The issue is much more complicated than that. I don't think that 4.5% of doctors deliberately breached the law. The way the question was asked was much more complicated and meant that there was a risk that might occur in the actions that we take.
Is this the concern, though, here? Because at the end of the day, as I see these, and I imagine there is more to it than the report that I've read, but as I look at this, it strikes me that these doctors are actually breaking the law, which is perhaps the biggest reason why we have to look at that law, because these doctors are also doing the right thing for their patients.
I don't believe that they're breaking the law, and I don't think that they believe that they're breaking the law. The way the question was asked simply meant that there were a risk that an outcome might occur. The law is clear currently, and in my view, this was not the intent.
Professor Glyn Owens said this about the findings. He said, making assisted dying legal does not, by waving some magic wand, miraculously stop it from happening, making it illegal, doesn't miraculously stop it from happening. Rather, it simply means that the practice continues without any clear regulation, guidelines, and, importantly, support for the practitioners involved.
There's no question that this is a complex, ethical, moral, and medical decision that we're making. We're making it in the context of family. We're making it in the context of the patient and their wishes. Having a framework in which we can do that more effectively would be hugely valuable. Therefore, I welcome the current debate because it's an enabler for us to understand how society might look upon these forms of issues, because it's going to be society that will determine the outcome for our profession.
Right. But in the immediate instance where you've got a patient who is desperately ill and about to die, and a doctor is making the best decision for that patient, the right for him to do what he's probably doing doesn't exist in some cases at the moment. I mean, one of the interesting things here is the number of times that nurses have been called upon to administer a drug that the doctor is said to administer for the purpose of hastening the end of that patient's life. So really, this is something that needs to be addressed now, isn't it?
As I say, we would welcome a debate to explore this issue further. It is complex. We're talking about a number of different set of circumstances that we're referring to here, and each of these circumstances in which people are dying is an individual set of circumstances with a bunch of rules around it. But the reality is that we have to be able to tailor our care to the needs of the individual. People have the right to die with dignity, and to a large extent...
Arguably, at the moment in New Zealand, people don't have the right to do it. And that's the issue, isn't it? And one of the other things that I thought was interesting about this survey is that it would appear that more and more often patients are wanting to have those conversations with doctors.
And that more and more often they are having those conversations with doctors.
Putting the doctor in a very awkward position quite often. Tim, thank you very much for joining us. Pleasure talking to you. Dr Tim Malloy, who is the Royal New Zealand College of General Practitioners President.